You're watching Cetome TV. Knowledge is power.
Why don't we talk, just back up the bus a little bit from the topic of treatments and just talk a little bit about some of the common symptoms or things that people, might be able to be on the lookout for themselves for breast cancer and what to do if they see them.
Well, I think the best thing to do is go to your doctor for that.
Mm.
Definitely there's many different signs of breast cancer. If you have any suspicion, get a PET CT.
Mm.
Don't waste your time with mammograms or anything. Definitely get a PET CT. Do not waste your time with x-rays.
That's a good point. The ultrasounds, the mammograms, the x-rays are not going to tell you definitively that you do or don't have cancer.
Right, exactly.
Yeah. So, okay, so I'm still going to drill down a little bit into this question here, because there's I would imagine either as a potential breast cancer patient, I'm going to either notice lumps or I'm going to notice lesions.
Right.
One or the other?
Yes.
Mm-hmm.
And you're going to notice changes in your nipples. You're going to notice changes in all sorts of things. So
Okay.
I think that's I think just being observant and pain, obviously. Although really I don't like to go by symptoms. Because some people are strong and tough and they just ignore the symptoms, or they're out of touch with their bodies. And they just ignore the symptoms. So I think it's really important that if you feel different or if you feel something, be aggressive. Catching it early is everything.
Right. Insist on a PET CT, because that's a type of imaging technology that's going to allow you to find out right away whether you do or don't have cancer, and where throughout your body, not just that one particular area that they might look at with an x-ray or an ultrasound. Yeah. That requires, for starters, PET CTs cost some money, depending on where you live, what country you're in. In the United States, they're less expensive and far, far more accessible.
Yes.
They're often ordered as a matter of course. In Canada, they're not ordered for cancer diagnosis unless patients really insist on them. And even then, it's really dependent on your doctor and their understanding of PET CT and how valuable it is, and whether they're able to get that for you based on what their province allows or doesn't allow. But there are private PET CT clinics in the United States and Canada and elsewhere in the world if your medical system doesn't provide them for you, and they cost anywhere from, depending on where you live, they can cost anywhere from about $1,800 to $3,500.
And you don't need a high dose CT scan. You can just get just the PET imaging by itself is good enough. Even PET with an X-ray is good enough.
Well, that's good to know. So you might save some money and
cut down
on your radiation.
You definitely want to cut down your radiation. Yes.
Yeah. One of the things that I've read about PET CT versus CT is that because of the conclusiveness that PET CT can offer that a CT scan can't, and how they can tell you right away, and you don't need repeated scans for contrast. You ultimately end up getting less radiation if you use PET CT for monitoring than CT scan.
Yes. So any kind of imaging like CT scan requires serial scans. So in other words, they measure the tumor at one point, or what they suspect to be a tumor. They don't know if it's a tumor or not, and so they measure it, and then if it grows, then they say it's a tumor, and if it doesn't, then they say it's benign.
Right. So there's at least a 3 to 6 month window in there while they're waiting for the next test for contrasting.
Yeah, I think that's an excellent point. Whereas with the PET CT, obviously, it's a one shot. That day.
Yes. So with a lot of things to do with cancer care right now, anywhere in the world, there are so many options for very thorough diagnoses, for targeted treatment plans. It's really just a matter of how assertive you're going to be on your own behalf, and whether you're going to add some extra research or testing to the treatment plan that your oncologist is preparing for you, or whether you're going to go simply with their recommendation. And these scans are a great example where, again, depending on where you live, some of our clients have been able to get PET CTs paid for, within their healthcare system or insurance coverage. Others have had to pay out of pocket. Some doctors have refused to prescribe them, and other doctors prescribe them as a matter of course. The science is pretty sound that they, as we've just said, will tell you very quickly whether you do or don't have cancer, except in a couple of cases, right? There are a few cancers that aren't so easily detected by PET-CT. Is that right?
Yeah,
like
I think that's
blood-based
changing.
cancer? Or is that
I know,
changing?
no, yeah, that's changing. Yeah, they're
well,
coming
that's
out
good.
with different isotopes and so on. So.
Oh, wow. Okay. So I just learned something new there.
Yeah.
So these things that used to be hard to detect with a PET-CT are not so conclusive. We don't even need to worry about that anymore.
Well, I think there's some cancers that are more PET avid than others, but I think all cancers at an advanced stage are fairly aggressive and visible through a PET. Yeah.
All right. Well, that's good to know.
Thank you for watching Ketome TV. Subscribe below and stay informed.